Hi everyone, welcome to Pathology and Genetics classes for second year BSc Nursing students. Let's begin with the chapter 1, that is Introduction to Pathology. Now I'm definitely sure that you people must be aware of two terms. One is health and other is disease. Health, you call a person healthy when he is at complete ease or comfort to the body. That is, he is in a state of being well or free from any illnesses. Whereas disease, it's exactly opposite of health. Disease itself, if you divide this term, it is made up of two words, dis and ease. Okay, so it is opposite of ease. So you call an individual is having a disease when there is loss of ease or loss of comfort. Now what is pathology? If you take this term pathology, it can be split into two words, that is pathos and logy. Patho is suffering or disease, whereas logy is the study. So in simple terms, pathology is the study of suffering or disease. For example, take a normal healthy liver. We know that liver is the largest organ in the body and it has various metabolic functions. Now suppose in the same liver there is cancer that is happening, which I've shown here in the yellow region. So what will happen to this part of the liver when there is cancer? Will it function properly? No. Will the structure be normal? No. So the study of the structure and function of any organ or the body when it is having any illness or disease is pathology. So with this background, we come to the definition of pathology, which is nothing but it's a scientific study of the structure and function of the body, remember, in disease. The pathology in your textbooks is broadly divided into two parts. One is general pathology and second is systemic pathology. General pathology, it deals with the general principles of the disease, whereas systemic pathology, it deals with the disease pertaining to the specific organs and body systems. Now, what do you mean by this? Now, to simplify this, suppose there is some injury to your skin. If you zoom in this area, this is your skin, which is made up of epidermis and dermis. There is an injury that is shown here. The injury is with a needle prick injury or a pin. Whenever there is injury, some bacteria enter your skin. So what will your body do? Your body will bring the WBCs from the blood vessels outside. Okay, so you can see here WBCs are coming out and they are going at the site of this injury. These green color what you're seeing are the bacilli. So what do the WBCs do? They start killing up these bacteria by phagocytosis or engulfing them, and they will also heal this injured part. So what is happening here? So here you can see that whenever there is any injury, this is the process that is taking place. That is how the body reacts to the injury. So this is the general principles of the disease. Whereas in systemic pathology, the same principle will be applied to various other systems. You might have heard about systems in first year. Gastrointestinal system, respiratory system, hepatobiliary system, urinary tract system. Yes. So the same injury, if it happens to the system. Now here in this figure, you can see the injuries happen to your intestine. Here there is injury to the liver. So the same process. So from the blood vessels, your WBCs will come out and they will kill the bacteria and heal this area, injured area. So that is systemic pathology. Now there are certain terminologies that you need to be familiar before beginning pathology and genetics. The first terminology is patient. Yes, you already know it. A patient is a person who is affected by disease. The second terminology that you should be knowing is etiology. Etiology means the cause of the disease. For example, take tuberculosis. Tuberculosis is a disease, and the cause of tuberculosis is Mycobacterium tuberculosis. So, the cause of tuberculosis is a bacteria. So, in our body, there are various diseases which can be caused either by bacteria or viruses or some chemicals or drugs, or even your genes can be cause for your diseases. You might have heard of mutations. Yes, so genetics can also be a cause of the disease. And last, they can even be physical agents like your heat, cold, acid. All these come under physical agents which also cause your disease. So etiology means cause of the disease. Next terminology is pathogenesis. What is pathogenesis? It is sequence of events of a disease. Now to simplify this, take example of this picture, right? You all tell stories. So whenever you tell a story, you tell that first this happened, next then this happened, then at the last this was the end. So same way in your disease also, whenever any disease happens in your body, there is a sequence of events that happens. That is known as pathogenesis. For example, in this picture, again we take example of liver. This is the normal liver, and here this you can see this is the cancerous liver. So normally first this is the normal liver cell. Then in this cell there can be some mutations which results in DNA damage, which will result in a defective or damaged cell. Now this damaged cell, if it proliferates or multiplies, it will result in cancer. So what you're telling? This was a normal cell, then it became defective, then at last it multiplied and became a cancer. So this is the sequence of events of a disease from the time it initiated or started to its final stage. That is meant by pathogenesis. Next terminology which you will come across commonly in your textbook is gross changes. Gross changes are the changes that you see in the organ with your naked eyes. Gross changes is also known as macroscopic changes. So here take example of a normal liver. This is the normal cut section of the liver which is meaty brown in color. Now suppose in the same liver if there is cancer. So what difference is seen between these two images? Yes, in the second image you are seeing multiple grey brown to grey yellow areas. Okay, so these are your cancer nodules that you are seeing directly with your naked eyes or macroscopically in this liver. So the changes in any organ which you see with your naked eyes is known as macroscopic changes or gross changes. Now similarly, you have microscopic changes. Micro is exact opposite of macroscopic changes. Microscopic means the changes that are visible only with a microscope. Take the same example of liver cancer. If this cancer cells, you take out some tissue bits from it and make slides, okay, and then stain it and see under microscope, you will see large cancer cells of the liver. So this is the change or the changes that you see in the cells at microscopic level is known as microscopic changes. Next is clinical features. Clinical features includes signs and symptoms. Symptoms means what the patient complains to the doctors in his own language, whereas science is what the doctor notices. For example, take a patient with anemia. Anemia is decrease in hemoglobin. So the patient will complain of breathlessness, easy fatigue in anemia. And what is the signs that the patient doctor will notice? Yes, he will look into the eyes or the nails or tongue. There will be pallor. So that is signs and symptoms. Next is lesions. Now lesions are characteristic changes in the tissues and the cells produced by disease in an individual. So here you can take example as I've shown in the picture, it is chicken pox. So these are the characteristic lesions which will be produced by that particular disease. Next is diagnosis. The diagnosis is identification of what disease a patient is having. For example, take during COVID time, the patients complained of high fever, breathlessness. Yes, okay. So what did the doctor do? The doctor advised for PCR tests, right? Rapid PCR. And if it was positive, the doctor comes to a conclusion that the patient is suffering from COVID. So that is your diagnosis. Next is prognosis. Prognosis and diagnosis are different things. Prognosis will tell you the outcome of the disease. What will be the future of the disease? Now suppose, example, tuberculosis. Tuberculosis, what will be the final outcome? If the patient takes proper treatment, he will be treated and he will come back to a normal life. But same way, suppose if a patient is suffering from AIDS, what will be the final outcome? Obviously, he will die. So, prognosis is an informed estimate of the probable course and biological behavior of a disease process. It will tell you the outcome or the future or end point of that particular disease. So, whenever you're studying a disease in pathology, right? Pathology is the study of disease. So, any disease in pathology will be studied under these headings. The first is etiology, which is the cause of the disease. Second, you will know the pathogenesis of the disease, that is, what is the sequence of events of the disease. Next, what are the changes that this disease has made in that particular organ. It will be both gross, which is your macroscopic changes, as well as at microscopic level. Then you will study about the clinical manifestations of that disease. What are the signs and symptoms? Then you will come to a diagnosis by doing various tests. And finally, you will tell the prognosis of the disease. That completes the first chapter, that is Introduction to Pathology.